Hi, this is Dr. Robbie Pauline. I'm trying something new for you. I'm going to offer some online materials for you to do it at home. This is physical therapy DIY. All right, this is my first attempt, and it's free, so you get what you pay for. This is all good information. None of this is going to be, outstandingly groundbreaking, but there's some really true principles here that I'm going to share with you. First of all, who is this not for? This is not for somebody with an acute injury, somebody with some recent trauma. You need to be seen by a doctor. This is not for somebody with severe neurological problems in their legs, feet. If you're falling frequently, you need to be evaluated by a doctor. If you have any changes in your bowel or bladder function, or you've had any recent infections, or a history of cancer with back pain, you should be evaluated by a physician and then start physical therapy. So this video is for people with what we call non-specific low back pain. It kind of hurts in a variety of areas and the pain might travel around a little bit. This video could also be for people with sciatica, that traveling pain down your leg. People with butt pain or leg pain when they're walking, standing, or trying to do some sort of a functional activity. And so I'm going to share some generalities. Not everything's going to apply to your case. You got to listen to that little voice inside that tells you, yeah, that's something I should try. And really this is experimental. When you're doing something on your own, you go through a little bit more materials, you make a few more trips to Home Depot, you buy a few extra sheets of plywood because you're going to have some trial and error here. I can't answer real specific questions on a feed because that would put me in the category of telemedicine or telehealth, and I have Practice Act limitations for that. And so I'm sorry I won't be able to answer any specific questions about your condition, so I'll have to speak in generalities. So basically, somebody with mechanical low back pain might have pain when they've been sitting for an hour. They might have back pain when they are standing in one position for a period of time. They might feel stiff in the mornings. They might have one of these catch pains when they get picking up something too heavy. This is somebody that might think twice about going to Costco and lifting a big old case of water, or might think twice about getting down on the ground to play with a little one. These are moms, these are dads, these are grandmas and grandpas. We see all ranges, young and old, have this sort of low back pain. In fact, this is the #1 condition that people visit their family doctors about. And more people are understanding the benefits of physical therapy, movement, exercise, and how that will benefit them. So I'm going to share some simple principles with you. Now, we're all looking for the pill, or the specific exercise, or the one thing that's going to fix our pain. We have become really dependent on outside help. The doctor can't fix me. I hear that all the time. They don't know what to do with me. I hear that all the time. These are people who have not yet taken ownership for the condition and health of their own bodies. Okay, once we realize that it's our body, it's our responsibility, it's our job to keep ourselves healthy, we're going to have what's called self-efficacy. And people with chronic pain have real low levels of self-efficacy, efficacy. Meaning that they don't believe that they can affect a change in themselves. And so as your first job as a new patient of mine here, I'm going to coach you to know that there is power within yourself to heal. And these simple things that I'm going to share with you are going to unlock that power within you to start to feel better. It's not your doctor's job. It's not your physical therapist's job. It's not your pharmacist's job to take away your pain. They are resources for you, and the power is within yourself. The second lesson is there's no wrong way to exercise. Okay? There is no proven 3-step exercise program to eliminate all back pain. There's a lot of different flavors of low back pain, and there's a lot of different exercise approaches. One of the few exercises that shows any research backing is walking. Okay, if you have back pain with walking, we want you to find that window where you can start to walk comfortably. Okay, if you start and at 5 minutes is when your pain sets in, that's when you turn around and go home. If you start for a walk and you can go for 10 minutes before the pain sets in, At 10 minutes, you turn around and go home. The goal would be to achieve a 5 to 10 minute walk a couple of times a day, to start to build up to having a 30-minute walk every day. There's a lot of good benefits to the core muscles, the back muscles, the buns, and also you get this big release of hormone activity, the serotonin, the dopamine, the oxytocin, all the goodies that make you feel happy and fresh inside. All of those chemicals, all those hormones are going to be there after some light aerobic exercise. So for day one, believe that you have the power within yourself to heal. It's not anybody else's job to fix you. I'm going to share with you some ideas. Your very first action item is go for a walk. But if I could walk, I wouldn't be looking up ways to fix my back pain. Okay, start small. We call it graded exposure. Take that little bite-sized piece that you know is going to be okay and do that again and again and again until you can go a little bit further. You should be walking every day if you have low back pain. And so stay tuned for the second installment. This is week 1. Look forward to our next encounter, and hopefully these things will help you find that power within yourselves to heal and start feeling like new again. Thank you.